Today, we'll be discussing the case of Elliott Williams. It's October 2011. Officers arrive at a hotel parking lot after reports of a disturbance. It was at this hotel where they met 37-year-old veteran Elliott Williams, and it was very clear he was suffering a severe mental breakdown. Contrary to their initial plan, this interaction ended with Elliott in handcuffs in the back of a police car. And this was only the beginning of a torturous 6 days for him in the Tulsa County Jail. For more than 51 hours, he remained on the floor of a jail cell, unable to eat, unable to drink, and most notably, unable to move. It was painfully clear that he needed to be immediately rushed to a hospital. He actually begged for the staff at the jail to help him. But for an entire 6 days, all of the staff members, officers, nurses, even doctors watched him as he laid there, helpless on the ground. When surveillance video of Elliott's time in the jail cell was released to the public, the entire nation was absolutely dumbfounded. And when medical experts reviewed this case, they were stunned to see such alarming misconduct displayed by the staff at this jail. This case would go on to be known as one of the most egregious cases of neglect and deliberate indifference to one's health in a jail. And after a thorough investigation, this case would soon reveal a very dark secret those in charge of the jail had been hiding for years. What was going on behind closed doors at the Tulsa County Sheriff's Office was truly alarming, and it would only reveal a larger problem unfortunately taking place at many jails across the country. But before we get into this case, just to introduce myself, my name is Petal Palmer, and on this channel I post anything medical, mysteries, and crime. If that is something that sounds interesting to you, please consider subscribing if you end up liking this video. All right, let's get into this case. On the evening of Friday, October 21st, 2011, police in Owasso, Oklahoma received a call reporting a disturbance at a local Marriott hotel. 2 officers from the Owasso Police Department, also known as OPD, were sent to the scene to make sure everything was all right. These officers were named Jack Wells and Ben Wallery. When they arrived on the scene, they saw a man in the hotel lobby, and they saw that this man was behaving, quote, strange and erratic. This man was named Elliott Williams, and he was suffering from a very serious and concerning psychological problem. Elliott Earl Williams was born on Friday, January 18, 1974, to parents Earl and Katha in Pine Bluff, Arkansas. Not much is available about his upbringing. However, sometime as an adult, he enlisted in the Army. By the time of this case, he was a veteran, and he had a wholesale business. Elliott's brother described how much he loved his family. He was one of 9 siblings. He had 6 brothers and 2 sisters who he was very close with. He was described as being very family-oriented. Even as an adult, he was extremely close with his siblings and every week would see them 3 times at church. His parents had been married since their early 20s when they were about 22, 21 years old, and they stayed together for their entire lives. They met in 2nd grade in Pine Bluff, Arkansas. It was in this union where all of the children, including Elliott, was born. Then the family moved to Chicago, Illinois, then back to Arkansas, and later on, they settled in Tulsa, Oklahoma in 1993 when Elliott was about 18, 19 years old. His parents were ministers, and his brother described that eventually, as an adult, Elliott was hoping to start a ministry himself. When asked to describe Elliott using one word, his older brother Kevin described him as blessed, further describing, quote, "It was hard to meet Elliott and not like him." Elliott was described as loving his mother dearly, but unfortunately, at some point around 2011, his mother was diagnosed with cancer. Elliott had plans to work full-time in his parents' ministry, but as soon as he found out about his mother's diagnosis, he rushed to make sure he could help his parents out as soon as possible. While this was already a difficult time, this unfortunately wasn't all he was dealing with. I'm not sure when or why, but at some point, Elliott began having fallouts with his father. Not just this, because additionally, after dealing with some issues, he and his wife were separated at the time. All of this put a tremendous toll on Elliott's mental health, and with all of these significant stressors in his life, he soon began dealing with mental health problems. His family began to notice that he also wasn't sleeping, and his brother Kevin stated that this, quote, caused him to not become Elliott at times. On and just before that Friday of October 21st, 2011, Elliott was experiencing a mental health episode. And for days, he hadn't been sleeping. To my understanding, it seems like his family would care for him whenever these would happen. And at some point or different points, he'd even been to a mental health facility called the Tulsa Center for Behavioral Health. However, Elliott's mother had just recently had a cancer surgery done. So with his wife in recovery, his father, Earl, thought it would be best for Elliott to not stay in their home with the current state he was in at the time. And after thinking about it, he thought it would be instead best for Elliott to stay at a local Marriott hotel that evening. According to a medical expert report, when police were called, Elliott was with his father in the parking lot of the hotel, and his brother and mother were nearby. Then, when the OPD officers arrived, they were met by Elliott, his father Earl, and his brother Clifton. Elliott's father, Earl, explained to the officers that they had rented Elliott a hotel room because for those past few days, he hadn't been sleeping and was suffering from psychological issues. And as they were in the lobby of the hotel, his symptoms only started to intensify. When they arrived at the hotel after checking in, as Earl walked toward the room, Elliott had thrown a soda on the hotel lobby's floor, and he ran right into the doors at the entrance. This was done with enough force that one of the doors actually dislodged from its track. In the documented police report, Officer Wells stated, quote, "It was readily apparent that Elliott was having a mental breakdown. He was rambling on about God, eating dirt, and then rambling on incoherently." At some point, Elliott began exposing his chest, and he also began lying on the ground. The police and his family tried to calm him down to get him to speak with officers, but it was very difficult and it was obvious something was wrong. The officers went up to the hotel staff to get some information on what happened. Hotel management explained to the officers that after the door was dislodged from its track, the hotel staff ended up fixing it. With this, they further said that they had no interest in pressing charges. However, what they did want was for Elliott to leave the hotel. Now, Elliott's father, Earl, explained to officers that with the current state Elliott was in, he couldn't have him come to his home because his wife obviously had just gone through surgery for cancer. So Elliott needed somewhere he would be able to stay. They further asked Earl some questions about Elliott's mental state and what might have been going on. So Earl explained to the officers that Elliott actually was in the midst of a separation with his wife, and he explained how this separation had left him depressed. The police then tried to talk to Elliott to ask about this and figure out what was going on. And when they asked him if he was feeling depressed or suicidal, Elliott actually denied this and further went on to continue rambling and speaking incoherently. So as this was happening, Earl told the officers that Elliott, quote, had been diagnosed with bipolar from the military. At that point, from the information gathered and what they'd seen, Officer Wells felt that there was nothing Elliott had done that justified him being arrested, and he also felt that Elliott was, quote, pretty much in a crisis moment. That being said, Officer Wells further explained that since Elliott hadn't, quote, said he's going to hurt himself, he didn't think that an adult crisis center called the Tulsa Center for Behavioral Health would have admitted Elliott. So what the officers decided to do instead was call a place called Community Outreach Psychiatric Emergency Services, or COPES, a place which offers around-the-clock mobile, emotional, or behavioral disturbance or psychiatric emergency services. After they were called, dispatch informed Officer Wells and Wallery that COPES was en route, which Wells replied to them on the phone stating, quote, "No, this one is having a complete and utter mental breakdown at the moment. So, we'll see what COPES can do." As they waited, Elliott sat on the curb, and it was then when his father Earl asked him if he had told his wife that he was planning on taking his life. Elliott hadn't answered this question at first, so his father repeated the question several times until Elliott finally stated that he did in fact tell his wife that he was going to take his life. And in the words of Officer Wells, at that point, he said that everything went south and sideways. Elliott stood up from where he was sitting on the curb, and he refused to sit back down. He went on to say that he and his wife were no longer married and that his wife was gone. But it was what happened next that really began getting concerning. Elliott began saying that he was going to take his life tonight, and he began pleading with the officers to shoot him, stating, quote, "It's a side." As he was saying this and asking the officers to shoot him, Officer Wells and Wallery were telling him, "No, we don't want to hurt you." To which Elliott replied, asking them, "What do I have to do to get you to shoot me?"
Elliott, not playing. Yes. You still cold? You want to sit in the car? I'm playing today. You want to sit in the warm car? Can I people to Elliott, do you want to sit in a warm car? Yes or no? It'll get you out of the cold. Would you like to sit in the back of a warm car? You can get out of the cold another way. How's that? Take a shot. Don't want to. It's two of y'all. Boom, boom. It's easy. Ain't playing today. You don't want to live anymore? Take a shot. Might be a side tonight. Mayweather. I ate dirt.
As he was saying that, he took a step forward toward Officer Woolery, and it was at that point when Officer Wells sprayed Elliott's face with pepper spray. They subsequently called for medics to flush Elliott's face, and shortly after, Owasso medics and OPD Sergeant H.D. Pitt arrived on the scene. As the medics flushed Elliott's face, Officer Wells explained to Sergeant Pitt everything that had gone on. And it was after Wells explained the situation when Pitt radioed over to dispatch, telling them to cancel copes so that Elliott could instead be arrested for misdemeanor obstruction. Wells placed Elliott in handcuffs to bring him to the jail. And in his later report summarizing the events, he stated, quote, Copes was called for the suspect due to showing signs of being in crisis. Suspect attempted to have officers kill him. Suspect was pepper sprayed and taken into custody after approaching officers and refusing to comply to lawful commands. They took him to OPD headquarters where he was sat on a bench. While on this bench, they kept him in handcuffs. However, they didn't secure him to the bench. So at some point, Elliott ended up rolling off of the bench and falling onto the floor. After this happened, the officers ordered for Elliott to stand up, but he refused to do so. So instead, at about 10:30 p.m., they picked Elliott up by his arms and drug him into a jail cell to complete their booking procedures. On duty at the time were Officer Wells, Sergeant Pitt, and Officer Lem Muti. Elliott was monitored by OPD jailers on surveillance cameras. As part of booking, he was required to complete an intake screening form. Now, on this form, there was a section that asked whether Elliott has thoughts of taking his own life. And for this part, he answered yes. Not just this, but the OPD officers were required to complete an arrest and booking report. And in the reports completed by Wells, it was indicated that Elliott was suicidal and that he had an affirmative answer to the question, do you feel suicidal or have you thought about harming yourself in the past 24 hours? With this, in their reports, they included a warning indicator that Elliott wanted to take his own life. It was there inside the cell where they stripped Elliott out of his clothes and redressed him into an orange jail uniform. And it was also there where Elliott's, quote, strange and manic behavior only continued, and he was showing signs that were consistent with acute and severe psychosis. He was moaning, sobbing loudly, swaying, rocking, pacing, shaking his head back and forth, humming, and he repeatedly sang Jesus. From how he was doing and the fact that he did pose a significant threat to himself, it should have been clear that he needed some kind of urgent mental health treatment. However, despite knowing of this risk that he would harm himself, instead of bringing Elliott to a mental health facility or bringing in mental health professionals so that he could get checked out and get the care he needed, they just left him in this holding cell. And what their plan was instead was that they were going to keep him in the cell until they were ready to get him transferred over to the David L. Moss Criminal Justice Center, also known as the Tulsa County Jail. This is a jail operated by the Tulsa County Sheriff's Office, also referred to as TCSO. Officer Wells explained that instead of bringing Elliott to a mental health facility, their plan was to bring him to the Tulsa County Jail so that he can get mental health treatment over there. But even with this being their plan, OPD still didn't take any measures that would ensure his safety and well-being. According to the World Health Organization, this could include using things like protective clothing or even in some cases restraints. But Elliott was just left in that cell, and this allowed something very serious to happen next. At some point, Elliott had dropped off the bed in the cell, got on his hands and knees on the floor, and he began barking and screaming. While on all fours, he was crawling around, and in general, he was just behaving in a way that was clearly not normal. But this wasn't all, because while he was crawling and barking while on all fours, Elliott began repeatedly slamming his head against the cell door. And he didn't just do this once, but multiple times while in there, he was hitting his head against the cell walls with great force. At that point, it should have been very clear that not only did he need immediate mental health assessment, but he also needed a physical assessment to make sure he didn't have any injuries to his head and neck. But despite this, they did not transport him to a hospital to get checked out, still just maintaining the plan to take him to the Tulsa County Jail for treatment over there. Elliott ended up pulling off his pants and scratching his legs. Following this, he then took the small mattress off the bed, placed it under the bed, crawled under the bed, and flopped around on the floor. He then stuck his head out from beneath and used either or both of his mouth and teeth to grab his pants on the floor, and he just repeatedly rolled his body and screamed. As mentioned, the holding cell was monitored by video surveillance, so the OPD jailers were able to see everything that was going on in there. And with how Elliott was doing, the jailers informed Officer Wells that Elliott was acting strangely and that he crawled beneath the bed. After Wells was informed about this, he, Sergeant Pitt, and Officer Muti entered in the cell. When they entered in, they saw that Elliott was under the bed, so they asked him to come out. But in response to this, Elliott slightly came out from underneath, moaned or growled, and then went back under. Muti ended up coaxing Elliott out from under the bed, and after being in that cell for about 2.5 hours, it was at 1:08 a.m. on Saturday, October 22nd, 2011, when they placed him in handcuffs to transport him to the Tulsa County Jail. To help transfer Elliott to the jail, the off-duty OPD captain, Tracy Townsend, was called in to assist Officer Wells, who informed Townsend of what had happened. After getting him in the transport vehicle, it was then at 1:31 a.m. when they arrived at the jail, removed the handcuffs off of Elliott, and placed him in a pre-booking cell. Now, once they were in the pre-booking cell, they actually told Elliott to change out of the orange clothes he was wearing from the Owasso jail to instead put back on the clothes he initially had on before they stripped and redressed him. Elliott, however, refused to do this, and soon enough, a struggle ensued. Officers opened the door of the cell and carried Elliott out into the pre-booking area as they attempted to place him back in handcuffs. However, they were struggling to do this, and eventually the officers took Elliott down to the ground by his head and neck, with Officer Wells landing right on top of him. Once this happened, they got him in handcuffs and walked him to the booking area so that they could hand him over to the Tulsa County Jail detention staff. Now, as they were heading to the booking area, Elliott was able to walk, but it was visible that he was having some difficulties doing this. Still, they eventually arrived at around 1:50 a.m. and had Elliott sit in the process waiting area. So as mentioned, Wells explained that the reason he and the other OPD officers didn't attempt to find mental health assessment or treatment for Elliott was because he believed the Tulsa County Jail would provide this for him. He did provide them with the booking reports he made. However, later in the investigation, he stated how he didn't recall telling the jail staff that Elliott was suicidal or suffering from mental health problems, or even informing them that they brought him over so that he'd be able to obtain mental health assistance. Likewise, he never confirmed whether the jail staff actually reviewed the paperwork or not, so it's unknown if this even happened, which is a crucial detail because after the Tulsa County Jail took custody of Elliott, the Tulsa jail staff did not place him on watch, nor did they take measures that are required for inmates with mental health needs. And it hadn't even been an hour since being there before something extremely concerning happened. Not much information has been stated of what exactly happened in the process waiting area, but according to one of the court documents, it was due to Elliott's, quote, defiance that the officers forcefully brought him into a holding cell at approximately 2:15 a.m. Specifically, he was brought into holding cell number 10, but it was just about 45 minutes of being in the holding cell at approximately 3 a.m. when detention detention staff were approached by another inmate named Mario Wilson, alerting them about something that had happened to Elliott. At jails, some inmates work as trustees, in which they are given different jobs to do around the jail, such as serving food or mopping, amongst other tasks. Mario was working as a trustee in the booking area, and he had witnessed Elliott falling to the ground after ramming his head into the door of the cell. After seeing this, Mario immediately alerted detention staff, and it took about 20 minutes of Elliott lying on the ground before detention staff responded and called a nurse. The medical staff at the jail were employed by the Correctional Healthcare Management of Oklahoma, Correctional Healthcare Companies, and Correctional Healthcare Management, also referred to in documents as CHMO, CHC, and CHM. And they were contracted by the Tulsa County Jail to provide medical and mental health care there. Jail officials, Corporal Jackson, Deputy Holloway, and licensed practical nurse, or LPN, Kimberly Hughes, responded by heading over to Elliott's cell. When they arrived, they found Elliott face up on the ground in the cell, and he told them that he had rammed his head into the door, that he broke his neck, and he told them, quote, "I can't move, I can't move." But get this, even after telling them this, the staff did nothing about it. This information was never recorded in Nurse Hughes' notes, and the staff just left Elliott in that holding cell where he stayed for the next 10 and a half hours with no treatment. All of the jail detention supervisors, quote, all had knowledge of Elliott's complaints of neck injury, but they still left him there. While in the booking area, Elliott kept on screaming that he couldn't walk. Not just this, but he was also feeling severe pain in his stomach and felt as though something was inside of his rectum, so he was pleading with the jail staff to, quote, "cut it out of my belly." This wasn't all, because Elliott was showing additional signs of someone suffering from a serious brain injury. His hands were posturing, and at some point he, quote, either had a seizure or exhibited seizure-like movements while in the booking area. Not just this, but it was stated in documents that while there in the booking area, he might have even hit his head on the floor. But still, with all the information they knew, which should have prompted emergent medical and mental health care, he still wasn't transported to an appropriate facility, nor did any person within the jail ensure he was provided with a CT scan, MRI, or any other diagnostic assessment for his possible head trauma. With Elliott being injured and unable to move, eventually he had defecated on himself on the floor. It was only sometime between 1:22 p.m. and 1:30 p.m. that Saturday afternoon when he was finally seen by a booking nurse named Faye Taylor and a detention officer named Heather Reed. During this meeting, the nurse was told that while Elliott was at the OPD, he had rammed his head into the holding cell door. The document says that, on information and belief, Elliott told them this. But nonetheless, if it wasn't him to tell them this, they were still informed about it. And it was after hearing this and seeing that Elliott was unable to get up when Nurse Taylor and Officer Reed officially declared a medical emergency. After this was called in, they ordered for a gurney to be brought to Elliott's cell to carry him to the medical unit. There was a jail trustee named Derek Latham who was tasked with bringing gurneys to cells where emergencies were called. So he brought the gurney over to Elliott's cell. But when he arrived, he described what he witnessed about Elliott's treatment there. He stated that when he arrived, Elliott was surrounded by the detention officers, and they were screaming at him to get up and saying that nothing was wrong with him. Latham described that as this was happening, Elliott was complaining that his neck was broken and that he was unable to move, but the officers continued yelling at Elliott with, quote, real vulgar language. The officers lined the gurney with trash bags, picked Elliott up by his arms and legs, and placed him on the gurney. As he was on this gurney on the ride down to the medical unit, he was not doing well. He continued to scream uncontrollably, and he kept on telling them that he felt like he needed something to be cut out of him. During this ride, he was accompanied by registered nurse Ernie Chappell. She was the head nurse at the medical unit. But like the detention officers, Chappell also didn't believe Elliott whatsoever. She thought that Elliott was faking his injury, and she got agitated and frustrated with him. She told Elliott that he was, quote, full of shit, and she further went on to complain about having to attend to him when she had too much stuff to do. They finally arrived at the medical unit where he was seen by a jail nurse named Mary Hudson. This nurse reportedly took his blood pressure and checked his reflexes by scraping the bottom of his foot with a pen as a test for the Babinski reflex, also called the plantar reflex. With this reflex, the big toe would bend upward or toward the surface of the foot, while the other toes spread out like a fan. Now, this is one of the normal reflexes seen in infants and in children up to 2 years old. However, it disappears as a child gets older, even disappearing as early as 12 months. So, in older children and adults who are healthy, the foot would either remain still or the toes may curl downward during this test. But if the Babinski reflex is shown in older children or adults, this can indicate a problem with the brain or spinal cord. The jail trustee, Derek Latham, stated that after the first 2 scrapes, Elliott didn't move whatsoever. And on the 3rd scrape, he said, quote, his foot like barely moved. Now, even though Elliott was genuinely unable to move, according to Latham, as Elliott was getting checked out, not only was the head nurse, Chapel, continually complaining about how Elliott smelled, but she cussed at and berated him. She told him that he should be ashamed of himself. She told him that he needs to get his nasty ass in the shower, and she told him to quit effing faking. With Latham further explaining that the jail's nurses, quote, didn't like working on anybody that's got feces on them and smells that way. They didn't provide Elliott with any medical treatment, and because the nurses didn't want to work with him, they instead decided to pass the responsibility of cleaning Elliott onto the detention officers, Captain Tommy Fike and Sergeant Doug Hinshaw. When they arrived, Captain Fike and Sergeant Hinshaw brought Elliott to the shower within the medical unit and told him to get off the gurney so he could get in the shower. The trustee Latham actually described that they told him to, quote, get the hell off the gurney. But Elliott groaned and told them that he couldn't feel his body and that he was not able to get up. Despite Elliott telling them that he was not able to move, Fike and Hinshaw decided to lift the top of the gurney, tipping it onto 2 wheels to dump him into the shower. When they did this, Elliott's head smacked onto the floor, and Hinshaw and Fike just removed his pants and shirt while one of the jail staff turned on the shower water, leaving him on the floor of the shower, water running on him, unable to move, with no help. Latham described that the way they dumped Elliott on the floor, it seemed as if they were angry at the fact that he had defecated on himself. But just making matters worse, not only did they dump him head first, but they left Elliott in that shower for a lengthy amount of time with his face up towards the water. After that long period of time went by with him on his back on the shower floor, the staff came inside, and instead of removing him from the shower, they decided to roll him over so that instead of his back being on the floor, his face was down on the floor. Again, he laid there for a long period of time. And by long, it was actually very long. According to witnesses, Elliott was left in the shower anywhere from between approximately 1 hour and 10 minutes to 3 or more hours until he was finally removed at around 4:30 p.m. Latham described that during that time, Elliott was begging for medical attention and was telling the staff that he needed help. Yet none of the jail staff were responding to him. He further described, quote, it seemed like he was in extreme pain. There were 2 detention officers on duty at the time named Christopher Leverick and Cindy West, who were asked to assist with taking Elliott out of the shower and moving him to a medical unit cell. They arrived at the shower only to find Elliott face down on the floor, and Leverick described how Elliott was screaming, help me. Sergeant Hinshaw went on to tell Leverick to roll Elliott onto his back to lift him up. But before doing that, they decided to place a trash bag on the gurney, which was done because, quote, there was stuff leaking out of Elliott's rectum. This wasn't all they noticed, because Leverick described, quote, it looked like Elliott had extreme lack of oxygen because his skin was a purplish color. They brought Elliott over to cell number 26 in the medical unit, where Leverick helped put him on a metal bunk and placed a blanket either under or over him. While there, Elliott was screaming that he needed something to drink, but he was unable to move his arms, and so Captain Fike helped give him one. Now, as they were with Elliott, Sergeant Hinshaw looked down at his arms, and he noticed that there was some discoloration in Elliott's left arm, just like Leverick had also noticed too. So Hinshaw called for a nurse to check him out. However, when or if the nurse did come, not a whole lot came out from that. According to Leverick, once they all left the cell, he, Hinshaw, Fike, and one of the mental health staff named John Bell began discussing that something was wrong with Elliott. Latham described that Elliott was shaking as he laid on his back with his hands near his chest, and he described that at some point Elliott was even offered food but was unresponsive. Latham further stated, quote, "I've never seen a man in that position," emphasizing that not once did he see Elliott move. At 2:05 p.m., Nurse Chappell wrote an intake note about what had happened. In this note, she stated, quote, "Responded to medical emergency in booking. Patient is awake, laying on floor in holding cell. States, I cannot move my legs and there is something in my rectum. Asking nurse to cut him open, kill him." As the day went on, Elliott continuously told the jail staff that he was paralyzed, he couldn't walk, nor could he move, but nothing came of it. At 7 p.m., there was finally a shift change with new staff. This included 2 detention officers named Carmelita Norris and Dakota Walsh, who were assigned to the medical unit for the overnight 12-hour shift from 7 p.m. on October 22nd to 7 a.m. on October 23rd. Not once during those 12 hours did Elliott walk, stand, sit, eat, or drink. The only movement that staff noticed was a slight twitch in his feet. As Norris went on security checks during her shift, she would hear Elliott begging multiple times for water. So to give him the water, officers Norris and Walsh, as well as a trustee named Andrew Johnson, worked together where Walsh opened and held the cell door, Norris and the trustee entered the cell, and Norris raised up Elliott's head and part of his back, getting him in a better drinking position to then pour the water into his mouth. Not only did Norris give Elliott water, but she also fed him a bologna sandwich, which she described required her to, quote, "hold the sandwich for him and hold his head and neck area and raise him up in order to give him the sandwich, make sure he completely chewed the sandwich and it was swallowed, and then I would give him more until he had ate the entire sandwich." Later that night at 11:11 p.m., another entry was put in Elliott's record by a licensed practical nurse, or LPN, at the jail named Raymond Stiles. In a progress note, he stated, quote, "Elliott states that he cannot walk. However, booking staff states he did not use wheelchair or any other walking aid when brought into jail. Continues to tell nursing staff here that he just cannot walk or even pull blankets over his shoulder. Wants to be waited on." As for the assessment in this note, he stated, quote, "Altered mental status. As for everything else, there were no vital signs or physical exams recorded." For most, if not all, medical records taken during the rest of Elliott's stay, the assessment section always stated altered mental status, and vital signs were not once taken, nor a physical exam. Elliott made it known to both Norris and Walsh that he was unable to move, and he continued making it very clear throughout that whole entire night. Throughout the entirety of the next day, on Sunday, October 23rd, Elliott just lied naked, continuing to let it be known that he was unable to move. He kept on yelling out he could not feel his legs, and this was heard by all the staff who were there, including a detention officer named Letitia Glover, who was on duty on the 23rd and the 24th. As she was hearing this, Glover actually reported to the nursing staff, telling them that Elliott, quote, "wants something," and further told them at least go down there and look at him. But none of the nursing staff went to look at him that day. In fact, despite his condition not getting any better, there were actually 0 health entries entered on Elliott's medical record that Sunday. Throughout the entire night, Officer Glover heard Elliott continuing to yell that he could not move. This was also heard by LPN Raymond Stiles, who was on duty at the time for the overnight shift, and actually recorded at 6:27 a.m. on Monday, October 24th, just toward the end of his shift, that Elliott, quote, "continues to state he can't walk or move." But continuing this note, Stiles wrote, quote, "But when his side blanket slides off, he manages to get it back over his body without assistance. Can't remember if he is suicidal or not." After Nurse Stiles left, the next LPN on shift was named Charity Chumley, and at 9:44 a.m., she put a note in Elliott's record stating, quote, lying on bed, refusing to answer any questions. Later that evening, Elliott was seen by one of the jail's mental health staff. This was a licensed professional counselor, or LPC, named John Bell. And Bell recorded a note stating that Elliott would, quote, lie on bed and not respond to questions, acted as if paralyzed, saying, I want water, referred to Dr. Harnish for med review. Big highlight on the fact that he wrote acted as if paralyzed. This Dr. Bell referred to was a part-time psychiatrist at the jail named Dr. Stephen Harnish. It was apparently on that Monday, October 24th, 2 days after Elliott reported a broken neck and paralysis, when Dr. Harnish was first notified of Elliott's condition. However, there's conflicting evidence on whether he was notified on that Monday or if he was notified the next day on Tuesday the 25th, because he didn't end up seeing Elliott on the Monday at all. In his later notes, he described that, quote, there was a concern that Elliott was saying that he was paralyzed, that he wasn't moving. There was a question of whether he had been active in booking. Further, he was told that Elliott was, quote, alleging that he had run into the door and was paralyzed, and he knew that Elliott was confused as to where he was. Still, on that day, Elliott received no medical care, and instead, the LPC, John Bell, recorded in his notes that he provided Elliott with education regarding coping skills. After hearing from the mental health team, Dr. Harnish ordered for Elliott to be moved into a video-monitored cell on side watch. Despite knowing Elliott had hit his head and claimed he was paralyzed, Harnish didn't order a neurological exam for Elliott or, quote, any type of medical examination to determine if there was a reason for that paralysis, because his team was focused on, quote, the psychiatric aspects of this particular person's case. It was at 8:27 a.m. the next day on Tuesday, October 25th, when detention officers carried out their orders from Harnish by placing a naked Elliott in a blanket and dragging him into medical cell number 1. This was a video-monitored sidewatch cell, and they placed him in there not because they wanted to actually monitor him in case he tried taking his life, but rather because they wanted to see if he was faking his injury, because what the medical staff believed at the time was that Elliott was suffering from psychosomatic paralysis. According to the Cleveland Clinic, a psychosomatic disorder happens when mental stress and distress cause or make a physical condition and its symptoms worse, with psycho meaning relating to the mind and somatic meaning relating to the body. The Center for Treatment of Mood and Anxiety Disorders also states, quote, the term is also used when mental factors cause physical symptoms, but where there is no physical disease. In Elliott's case, they believed that there was nothing physical causing his paralysis. They didn't place him in the video-monitored medical cell to give him medical care, but they rather did so to help rule out whether he was paralyzed or not, and to, quote, respond to any medical psychiatric condition as determined by monitoring. 12 minutes after being moved into the video-monitored cell, at 8:39 a.m., a detention officer entered the cell to place a small cup of water by his feet. But Elliott obviously was unable to reach it. Then, about 30 minutes later, at approximately 9:07 a.m., over 2 days since reporting a broken neck and paralysis, Elliott was finally seen by a medical doctor, who was none other than psychiatrist Dr. Stephen Harnish. Now, Dr. Harnish entered a medical entry in at 8:47 a.m. However, the entry states, quote, inmate seen with mental health team at 9:10 a.m. today. So there might have been an error in the time he reported. While in there, Elliott had requested a bucket of water and a tube to drink, and nothing else. The note continues to state, quote, he stated he had been here for 10 days, booked October 22nd, 2011. Claims he cannot move, but denies all medical reasons for this and stated it never happened before. When told he would need a nursing home when released if he continued to function like this, he said definitely not. He claimed not to know where he is and demanded a bucket of ice water and a tube to drink through. He refused an IV for hydration should he become dehydrated. He denied alcohol and drug use, claims he has a house paid for and a job of direct sales. He denied previous mental health care, but admitted to having been at Tulsa Center for Behavioral Health in the past. doubt medical etiology of claimed paralysis, plan place in video monitored cell, and respond to any medical as determined by watch monitoring. This visit lasted for approximately 11 to 12 minutes, but absolutely no medical evaluation was done. All Harnish did was move the cup within reach of Elliott's right arm. In fact, this was the first and last time Elliott was seen by a medical doctor at the jail. After this interview Harnish had with Elliott, Harnish went up to a member of the mental health team named Patricia Benoit. Benoit was a licensed marriage and family therapist, or LMFT. And he told her, quote, "I don't think this is medical, but it is really hard to tell." Benoit further described how, quote, "It was really hard to tell if it was psychosomatic or if it was physical." Still, nobody performed an evaluation on Elliott to rule out any physical or medical cause. An hour later, at about 10:10 a.m., a staff member from the jail opened the door of medical cell 1, where Elliott was in, and tossed a styrofoam food container on the floor. Elliott, of course, was unable to reach it. In fact, that very food container would remain in the same spot, untouched and out of reach for the next 2 days. After more than 3 hours passed, at 1:15 p.m., Elliott started making an effort to pick up the water cup. For almost an entire hour, until 2:10 p.m., he made several attempts to lift the cup of water, but none of these attempts were successful. About 3 hours later, at around 4:40 p.m., a staff member entered Elliott's cell and again threw a food container toward him. The difference with this container was that, unlike the last one, it was actually within reach. So for the next 10 to 15 minutes, Elliott used one arm and attempted to open the second food container, as well as again try to lift the cup of water. But he was unable to lift the styrofoam lid of the container and was not able to even bring the cup of water to his lips. Nonetheless, none of the staff members ensured he was properly fed or hydrated. At 7 p.m. that evening, the staff had their shift change. The LPN who clocked in for the night was Nurse Kimberly Hughes, the one who had actually first encountered Elliott a few days prior on Saturday the 22nd. She was going to be working from 7 p.m. that Tuesday, October 25th to 7 a.m. on Wednesday, October 26th. A little bit after she arrived that evening, she went to check on Elliott. She opened the slot in Elliott's cell door to speak to him through it. But when she saw him lying on his back on the floor, he looked so different than how he had looked 3 days prior. She didn't even know it was him. She thought that Elliott was a completely different person. Hughes saw Elliott, quote, lying there on his back, muttering to himself and rolling his fingers close to his chest area. Elliott told Hughes that he was paralyzed, and following this, there was no other response. He did not respond to Hughes any further, and according to Hughes, it was clear that Elliott was out of it. The entry from Dr. Harnish was the only entry from that day. There were no nursing entries recorded on the 25th. In fact, it was actually that very Tuesday afternoon or evening when Dr. Harnish had left the state of Oklahoma due to a family emergency. This made this the only time he had actually seen Elliott, and it would be days before Elliott was seen by a doctor again. The following day, on Wednesday, October 26, 2011, there were about 3 entries. The first one was at 12:57 a.m. by LPN Hughes, who recorded that Elliott was, quote, muttering, can't understand a word. Under objective, she wrote that he was, quote, lying on the floor, covered by blankets, will not get up for VS, and cannot understand his mutters. Keyword on will not get up. And under assessment, she wrote, seems alert at times, resp even, labored at times, skin damp and moist, no distress at this time. Just before 5 a.m. that morning, Hughes again checked on Elliott, and she described that she saw a white residue around his mouth and several spots of white at the top of the blanket like he had spit up. Hughes opened the slot of the cell door to call out to Elliott. When she did this, Elliott asked if she could get him some water. So you know how Hughes responded? She responded by telling Elliott to get his cup and bring it to the door. So again, Elliott told her that he was paralyzed and he was not able to do this. And after this, Hughes was like, you know what? Okay, let me go up to the officers and see if I can go inside. She went up to 2 detention officers, Stephen Smith and Crystal Rich, and she asked if they could open up the door to Elliott's cell. However, Both Smith and Rich refused to open the door as they claimed they were concerned for their safety, despite Elliott showing absolutely no signs of violence or aggression since ramming his head into the cell door a whole 4 days prior and being unable to move since. One of the officers explained, quote, "If he can get to the door, we will give him some water. But if he cannot get to the door, we are not going in there. That's the rules. We cannot open the door for our safety and your safety." There was no convincing them to open the door, and so Nurse Hughes stopped trying and walked away. Ideally, Nurse Hughes could have went up to her supervisors to inform them of her concern, or she could have even tried getting emergency medical attention for Elliott. But unfortunately, she didn't. So Elliott remained on the floor, not moving, and he was occasionally partially covered by a blanket and sometimes not. The next entry into Elliott's record was at 7:26 a.m. by a member of the mental health team. This was the therapist who had earlier spoken with Dr. Harnish, Patricia Benoit, and she wrote, quote, "Inmate still refusing to move or admit he can move to the therapist, but reportedly was given water by the detention officers overnight and was told to come to the beanhole, the slot in the door, to get the water, and he did. Also has been seen by detention officers on camera moving around." Benoit wrote this in her note despite none of this happening. Elliott had never gotten off of the floor, and none of the cameras showed him moving his legs or even attempting to do this. By that point, Elliott had been held in the jail for 4 days. He was detained for a misdemeanor, yet was never arraigned. He had no bond. He had never even made an appearance before a judge. And get this, by that point, he actually had no charges filed against him. But when Benoit saw Elliott, she told him, quote, if he wanted to be bailed out by his parents, he would have to walk/move to get to the car. Now, something to keep note of is that in the plan section of her notes, Benoit wrote that the plan was to maintain current housing, remove from suicide watch, mental health follow-up as needed, refer case to Dr. Harnish. The third note on this day was entered just 23 minutes later at 7:49 a.m. by an LPN named Carmen Luca, who recorded that Elliott, quote, refuses to move, stating that he cannot move, and this begun a few days ago. Housed to medical for suicide watch. Get this, under the education section, the note states take meds as prescribed. However, Elliott hadn't been prescribed any medications. So it was clear that there was misunderstandings with the actual treatment plan that was going on for Elliott. A bit more than 3 hours later, after 11 a.m., Elliott made another attempt to grab onto the food container that was within his reach. But as he tried doing this, he actually accidentally knocked over his cup of water and it all spilled on the floor. Despite this happening, nobody refilled or replaced his water. Now, in the medical expert report, it has a note listed for October 27, 2011 at 8:59 p.m. However, based on the timeline of events, this was a typo of the date because it rather likely means to say October 26. The note was put in by an LPN named Devorcia Stewart, who recorded, quote, inmate okay, lying on the floor, partially covered by blanket, shaking. Now, in the plan section, she wrote, continue in medical for suicide watch. The thing is, if you remember the therapist Patricia Benoit's notes from the day before, she stated that Elliott was to be removed off suicide watch. So there seems to be some differences in the understanding of Elliott's care amongst the staff. But what just makes the next part of her note absolutely ridiculous is that despite Elliott on multiple occasions over the past 4 days exclaiming that he was paralyzed, could not move, was thirsty, hadn't eaten, hadn't drank water, and hadn't moved whatsoever from the position he was dragged into that cell in over 36 hours ago, Stewart recorded that she, quote, encouraged Elliott to inform staff of needs or concerns. For that entire Wednesday of October 26, not one person entered Elliott's cell to check on him and no care was provided whatsoever. But it was the next day, on Thursday, October 27th, 2011, on the 6th day, when all of this changed. At about 5:10 a.m. that Thursday morning, video showed that in order to give Elliott his meal, one of the staff members didn't even open the door. They just opened the cuffing port of the cell door and dropped the container at Elliott's feet. It took 5 days of Elliott being there on that very Thursday morning when he was finally physically examined by a doctor. At around 8:36 a.m., he was seen by a visiting family medicine resident along with a member of the mental health team and an LPN. The resident was named Dr. Katka Limbu. The mental health team member was licensed practical counselor, or LPC, John Bell, and the LPN was Carmen Luca. Dr. Limbu was shadowing Bell and Luca, who, by the way, according to the second amended complaint document, Luca had only been working as a nurse at the jail for about 1 week at that point. The purpose of this visit was to again scrape the bottom of his feet as a test for the Babinski reflex. This was the first time on video since Elliott had been there when staff took turns running an instrument across the bottom of his feet. During Bell and Luca's turns, there was no response. During Dr. Limbu's, there was little response, however, this was not significant. Dr. Limbu, Counselor Bell, and Nurse Luca were all concerned with both the state Elliott was in and the lack of responsiveness during the test. Because of this, according to the court documents, Nurse Luca indicated that they approached the jail's medical director, Dr. Philip Washburn, to inform him that Elliott needed medical attention. She indicated that the group began discussing that Elliott should possibly be going to the hospital to get seriously looked at, and she indicated that Dr. Washburn subsequently discussed sending Elliott to the hospital. Bell then went to speak with the director of nursing, registered nurse Tammy Harrington, expressing that he was very concerned that Elliott's physical condition was worsening. And so Harrington directed Bell to immediately get Dr. Washburn to assess Elliott. Now, after she said this, Bell told Harrington that he did ask Dr. Washburn to assess Elliott. But get this, when Dr. Washburn was later interviewed, he said that he didn't remember being informed by either Bell or Dr. Limbu. Further, he stated that he never checked on Elliott, testifying, quote, "If it happened, it was my bad. Because if a resident doctor would have said that he needed to be sent out to the hospital, I would have sent him right out." Dr. Limbu told Dr. Washburn, the attending physician and medical director, that they would need to send him out to get medical help. But Dr. Washburn did not recall this happening. Thing is, although Dr. Washburn denied being informed that Elliott was in need of medical attention, the testimony he made did suggest that he had at least previously been informed about Elliott exhibiting paralysis, as he testified, quote, "Dr. Harnish evaluated him, I believe, and said it was psychosomatic paralysis. I didn't think I needed to go any further with it." So, because of this, not once did Dr. Washburn ever enter into Elliott's cell to look at him. And he was the medical director of the jail. The only medical record from that morning was put in at 8:36 a.m. by Counselor Bell, who recorded that Elliott was, quote, "laying on the floor with some spittle on cheek, speech unclear, mumbled, memory poor, insight, judgment, impulse control poor." And that Elliott stated, "I want my phone, I want my phone." Despite the concern they had for his condition, still, nobody called an ambulance or provided any kind of medical help. And it was only a little bit after this when things got much worse, because it was just a little bit after 11 a.m. that Thursday morning when Elliott was found unresponsive in his cell. Despite entering the cell at approximately 11 a.m., it took them a whole 4 minutes of being in the room at about 11:04 a.m. before they finally started performing CPR. And this is really serious because when there's a medical emergency and someone's unresponsive, you really need to make sure you're helping them as quickly as possible. 4 minutes of somebody unresponsive is enough for serious damage to occur. Once it was discovered that he was unresponsive, Nurse Luca and another LPN, Julie Hightower, entered Elliott's cell to begin resuscitation procedures. Luca and Hightower were on duty at the medical unit on this day. Hightower was assigned to the south section of the medical unit, whereas Luca was assigned to the north section, which is the section Elliott's cell was in. Shortly after, a third LPN, Charity Chumley, entered the cell to help. But Hightower and Luca were not moving urgently whatsoever. It's not uncommon for chest compressions during CPR to be interrupted for unnecessary reasons. listened. But it hadn't even been 1 minute since they started performing CPR when they experienced two notable interruptions, and the staff members performing the chest compressions appeared uncertain on how to do them. Elliott had been laying on top of a side blanket, and with him being on top of it, it was likely fine remaining under him. But nonetheless, rather than picking him up to move him from the blanket, they instead decided to grab the bottom of the blanket and yank it with such force that Elliott was flipped from on his back to face down on his stomach. Then, just adding to this, one of the staff members even used their foot to move him back onto his back. After this happened, they went back to performing CPR, but it was only just about 4 minutes later at 11:08 a.m. when the next major interruption occurred. They rolled Elliott to the side, which a nurse named Janet Lance described as being done in an effort to clear his airway. But then after this, they completely got off track from the resuscitation effort because they subsequently decided to try placing chucks, which are disposable liners, on the floor near his buttocks. The medical expert report states that this might have been done, quote, presumably to cover fecal matter or urine, but it is unclear why they do this. Nonetheless, this still had nothing to do with the actual resuscitation effort, so it was unnecessary. The only interruption that was described as being warranted was them trying to clear his airway, but even that should have only lasted for about 15 to 30 seconds. And then just in addition to all of that, there were multiple other brief interruptions. For example, at one point, they stopped the chest compressions to place chest pads on his chest. And while doing this was important, the medical expert report stated that they shouldn't have stopped in the middle of the chest compressions because then they didn't perform the correct amount. Typically, when performing CPR, it's ideal that the person kneel on the floor. However, the nurses didn't get on the floor. Rather, they just crouched down, and at some point, Nurse Luca tried to perform CPR while full on standing up. For all those 8 minutes from when the nurses first entered the cell, they only performed chest compressions for a total of 1 minute and 34 seconds. That means for 6 minutes and 26 seconds of them being in the room, no chest compressions were being delivered. Likewise, with Elliott not breathing, it was crucial that they ventilated him as soon as possible. The oxygen and equipment to do this was located in the medical unit where the cell was, but the efforts to do this was also very delayed. They finally brought oxygen into the cell, but this took a much longer time than it should have. Once the oxygen did get to the cell, they began applying a bag valve mask on Elliott, in a term referred to as bagging, a method to provide manual ventilation to someone who's not breathing. As this was happening, Nurse Lance and an LPN named Nicole Bynum were alerted and rushed to the room to help. Emergency medical professionals were called as this was happening. Once the Oklahoma Fire emergency crew arrived, they continued the resuscitation efforts before transferring Elliott to an outside hospital. But things were not looking good at all. Nicole Bynum wrote a note at 12:30 p.m. describing the incident in which she stated, quote, "At approximately 11:10 a.m., while I was in booking, Sergeant Darby told me that an inmate had died in medical. At that time, myself, Nurse Lance, ran to medical. Upon arrival, we were directed to room 1, where patient was on the floor, unresponsive, and nurses Hightower and Chumley were performing CPR on inmate. At that time, I entered the room, took over bagging the patient for 2 cycles of CPR. Then I took over CPR while Nurse Lance started bagging the patient for approximately 4 cycles of CPR until the fire department arrived and took over." Nurse Janet Lance also wrote a note 9 minutes after Nurse Bynum in which she stated, quote, "Inmate cold, in asystole, and pupils fixed and dilated. And I started bagging after doing a mouth sweep with 4x4 gauze to remove coffee grounds, emesis present. Elliott's body was lifeless, and he had blood coming from his mouth. By that point, there was really nothing else that could be done." It was on Thursday, October 27, 2011, when Elliott was pronounced dead at the hospital at the age of 37. The first of Elliott's family to receive the news were his parents. His older brother Kevin had just gotten off work when he received a call from his mother asking him to come to the house, and Kevin described that he could tell something was wrong. His mother then passed the phone to his dad and told him, quote, "Elliott is no longer with us." Kevin described that he actually didn't even know that Elliott was in jail, quote, until he was gone. He thought that Elliott was at the Tulsa Center for Behavioral Health, a mental health facility that he had been before. Following his passing, Elliott's remains were turned over to the Oklahoma State Medical Examiner's Office, where they performed a post-mortem examination. However, they were unable to determine a cause of death and ended up just releasing Elliott's remains for burial. Because of this, Elliott's family then took possession of the remains and had a private autopsy performed by forensic pathologist Dr. Collie Trant. And Dr. Trant went on to notify the Oklahoma State Medical Examiner's Office that the results from this showed that not only did Elliott have a fractured neck, but he had a significant hemorrhage in the cervical spinal column, and the results included a, quote, vitreous electrolyte analysis, which showed a dehydration pattern. From the autopsy, the medical examiner officially determined that Elliott had passed away from, quote, complications of vertebrospinal injuries due to blunt force trauma. A medical expert named Dr. Zishan Khan was tasked with analyzing this case, and his opinion was that because the jail failed to stabilize Elliott's neck or cervical spine, this resulted in a hematoma traveling up his spine, shutting down the spinal cord, and in turn caused his respiratory or breathing muscles to shut down, which ultimately caused his death. A hematoma, by the way, is, quote, a closed wound where blood collects and fills a space inside your body because it can't flow or drain out. Dr. Khan further emphasized that had they stabilized his cervical spine or neck and referred him to an appropriate medical facility, his death would have been avoided, and it was, quote, probable that he would be ambulatory today. Still, even with this evaluation, Dr. Washburn stated that in his opinion, Elliott, quote, received appropriate care while he was housed on the medical unit at the jail, and that people just die sometimes. He really said people just die sometimes. I'm so sorry. You know what that kind of reminds me of? It's like that one moment when during quarantine when Vanessa Hudgens was like, yeah, people are gonna die. Like, he literally said that. Like, that is literally exactly what he said. I'm sorry, I didn't even mean to bring that up. That is so off script. But like, what do you mean people just die sometimes? Like, you can't say that in like this situation. Like, it's not oh, it just happened. Huh? This man really just said it'd be like that. No! What are we? We're straying further from the. The detention chief deputy at the time Elliott was in the jail was a woman named Michelle Robinette. And after watching the over 50-hour-long video of Elliott in Medical Cell 1, she testified that from what she observed in the video, Elliott was not properly fed, nor was he provided appropriate hydration. She stated in part, quote, he was given a styrofoam cup of water placed at his shoulder that he never drank, that was kicked over by a doctor and never replaced, or a nurse. I can't remember which. He was fed with styrofoam trays, which is normal. They were either placed inside the bean hole or put on the floor in front of the door. And no time during that video did I see him go to them and eat any of the food out of them. None of my detention officers took the time to open the door to verify that he was eating or assist him any. She further stated that how Elliott was treated was inhumane and a lack of human decency. Make sure you keep a note that this is what Michelle Robinette initially stated. Very shortly after Elliott's passing, on Monday, November 14th, 2011, the Oklahoma State Bureau of Investigation began conducting an investigation. This lasted until New Year's Eve on Saturday, December 31st, 2011. A former sheriff's office captain named Bill McKelvey also investigated Elliott's passing and used his findings to complete a thorough internal report completed on Friday, March 2nd, 2012. Likewise, Dr. Scott A. Allen did a medical expert report on the case. And I'm going to be discussing all of his findings after he did a thorough analysis. To say the least, the evidence they found was extremely alarming. From the moment Elliott arrived at both the Owasso Police Department headquarters and the Tulsa County Jail, it was made known that he was a significant risk to harm himself. It was clear he was suffering a serious mental illness which needed immediate care, and it was also known that he had hit his head and neck with great force. But these were all brushed off. He received no mental or medical care, and nothing was done to check if he had a physical injury. In fact, there was 51 hours of footage they reviewed from the moment Elliott was dragged into the medical unit cell until he passed away, showing the indifference to his health. Despite Elliott expressing his inability to walk or move his legs, despite him experiencing trauma on his head and neck, and despite video surveillance showing this, the staff never took neck injury precautions and just assumed that he was faking his paralysis. The medical expert report also brings up the problem of, quote, nurses appearing to make assessments beyond the scope of their training without the apparent input or consultation with a physician. Their observations that he does move his upper extremities appears to cause them to conclude that he is not paralyzed, despite the fact that he never moves his lower extremities. The level of his neck fracture and observable arm movements are not inconsistent with a lower cervical fracture with spinal impairment, mostly affecting the legs. Since that intake shower where he was left on the floor, Elliott had never been able to bathe again, nor was he ever able to get a toilet or commode. And despite being unable to reach his food or handle his cup when placed in reach, he was never assisted with eating or drinking, except for that one time in the whole of 6 days. Despite medical records documenting clinical deterioration in Elliott's health, no medical action was ever taken by the staff to address this. His vital signs, which the medical expert considered the most basic assessment, were never taken once, and he was never physically examined by a medical doctor other than when the physician in training, Dr. Limbu, came to scrape his foot many days later. A lot of the nurses made an assumption that he was not paralyzed because he was able to put the blanket back on or because he was able to move his arms, totally negating the fact that you can have just lower paralysis. You could be not paralyzed in your upper extremities, but paralyzed in your lower extremities. But a lot of the staff were just like, oh, well, he moved his arms. He must not be paralyzed. He must be faking it. Even though you can be either fully paralyzed in both your upper and lower extremities, just paralyzed in your upper extremities and not lower extremities, or even just paralyzed in your lower extremities and not your upper extremities. But they didn't take that into consideration. And no doctor looked at him who should have been able to tell, oh, that doesn't mean he's not paralyzed just because he's moving his arms, because a trained medical professional should know that that wouldn't even matter, that his lower extremities could still be affected. As for the attempts at performing CPR, the medical expert report states, quote, resuscitation efforts are deplorable and well below standard of care until outside rescuers arrive. The medical expert report by Dr. Allen significantly pointed out the prejudicial and dismissive language used towards Elliott's condition in the medical reports, including the LPN Raymond Stiles stating, quote, wants to be waited on. John Bell, the LPC, stating Elliott acted as if paralyzed, even though he was paralyzed. And also the note from LPN Hughes saying, quote, will not get up for VS, instead of saying that he cannot get up. Now, when Elliott was found unresponsive in the cell at approximately 11 a.m. that Thursday, Dr. Allen stated that he believes that Elliott was already beyond resuscitation by that time. However, he further emphasized how notable that moment was when they performed CPR that morning. It was the only time county jail staff attempted to perform medical duties in Elliott's 5 days there. Dr. Allen described CPR as, quote, one of the most basic skills and competencies of medical professionals, further describing how the basic form, which is called basic life support, or BLS, is a required competency on non-medical staff assigned to the jail medical area. Yet from the video, it appeared that both non-medical and even medical staff had, quote, minimal to no competence in even basic life support. He further explained, quote, I make this observation with the understanding that resuscitation efforts are relatively rare in jails, in prisons, and I don't expect medical professionals working in these environments to be the most polished and skilled in CPR. But I do expect them to demonstrate evidence of adequate training and an appreciation for the urgency of the effort. While medical emergencies like this are rare in jails, they are not unheard of, and this facility had other reported deaths within the facility in the preceding years. Further stating, quote, even the untrained non-medical observer should be able to stark differences in urgency, dexterity, and skill from the jail staff attempting CPR and the Tulsa fire staff who enter at the end of the video. Although they are supposed to be doing the same thing, the efforts appear to be entirely different. Tulsa fire staff act with urgency and skill. By comparison, the jail staff resuscitation efforts look confused, lacking urgency, unskilled, and unprofessional. Indeed, they are confused, lacking urgency, unskilled, and unprofessional. Staff performance is suggestive of inadequate training and lack of professionalism in the facility. Overall, medical expert Dr. Allen concluded that it's fair to say that, quote, Elliott received the most minimal mental health care and essentially no medical care. The only medical care I can find evidence consists of a poorly executed resuscitation effort that comes too late and includes some of the most incompetent efforts I have ever witnessed in my career as a doctor. There was ample opportunity for any of the staff, both medical and non-medical, to recognize and express how urgent this situation was. Yet this never happened. Overall, Dr. Allen concluded, quote, this is a very disturbing case. It involves the death of an inmate with clear and compelling serious medical and mental health needs whose needs are entirely neglected. He dies not only from lack of medical care, but also from lack of food and water, all while under the care of licensed health professionals. The fact that the medical staff settled on this incorrect diagnosis without doing a proper workup easily qualifies as medical malpractice. However, it is more than that. It shines light on a medical staff more concerned with a quasi-police role than their legitimate role as healers. The incorrect diagnosis of faked paralysis is followed by a plan conceived of and deployed by medical professionals to catch him in his alleged faking. So he is placed in a video observation cell, and the only thing they catch is their own glaring inhumanity and lack of professionalism. We see no medical care provided at all. From my perspective, these licensed professionals appear to have a primary loyalty to the correctional facility and a law enforcement approach. They have lost sight of their primary responsibility to their patient. And he further finishes with, quote, this is not only egregiously bad medical care, it is cruel, inhumane, and degrading in a way that even a layperson can see and understand. It is a level of neglect that is obvious even to the casual observer, and it is a level of neglect that shocks the conscience. With how bad they treated Elliott, unsurprisingly, this wasn't the first time this institution was cited for showing a lack of care for their inmates' mental and physical health. Dating back since 2005, when the then sheriff Stanley Glanz took over operation at the jail, there were several systemic deficiencies in the medical and mental health care of inmates. In 2007, an on-site audit of the jail's medical services program was conducted at the jail by outside reviewers from the National Commission on Correctional Health Care, or NCCHC. During that time, the jail's supervisor over medical records was a woman named Elandia Diane Malloy. Now, before this meeting happened, Sheriff Glanz and a Tulsa County Sheriff's Office official at the time named Tim Albin conducted a pre-audit meeting with department supervisors to emphasize how important it was that they pass the audit. It was alleged that at this meeting, not only did Glanz state that heads were going to roll if the audit didn't go well, but he and Albin supposedly told the medical staff that any problematic medical charts they have, they need to hide it from the NCCHC auditors. Malloy testified that at this initial meeting, they discussed which charts were going to be placed for the auditors to see because they didn't want auditors to see certain inmates. Malloy also testified that over 20 medical files were pulled and placed inside milk crates to hide from auditors. And she further asserted that when the auditors were there, inmates were moved around the jail and even moved off of the premises so they wouldn't be available to auditors. She testified, quote, Albin said that he did not want the problem charts to be seen by the auditors, and he did not want the problem inmates to be seen by the auditors. The health services administrator at the jail at the time was a woman named Pam Hosington, and Malloy testified that while the NCCHC audit was taking place, Hosington asked Malloy to falsify medical charts and indicated that, quote, she wanted every chart to be kind of altered if there was something in there bad or if there were sick calls in the charts that were not addressed. With this, Hosington directed the medical staff to create false files to provide to the NCCHC and to only select charts of inmates who didn't have a lot of medical issues and who were fit to give for review, calling them dummy charts. And this wasn't just the medical team, but staff from the Tulsa County Sheriff's Office also made attempts to steer the auditors toward the pre-selected or dummy charts placed in baskets that they wanted the auditors to choose from. Even with these attempts to steer the NCCHC and the alleged hiding of some problematic charts, they were still issued a preliminary report by the NCCHC in early 2007, which noted several problems that needed to be addressed by an action plan. These problems included medical staffing shortages with increased workloads, failure to timely triage sick calls at the jail, and inmates not being seen by a qualified healthcare professional within 24 hours due to the staff shortages with increased workloads. They were also cited for medical staff's insufficient education and knowledge with respect to screenings, diagnostic machine, mental health treatment plans, medication administration, and problem lists. Mental health treatment plans were not complete due to a lack of proper charting procedure, and the follow-up of inmates with mental health needs was not of sufficient frequency to meet their needs. There was no consistent follow-up by mental health staff. Not everyone taking psychotropic medications were scheduled for a follow-up evaluation, and there was a noted delay in response to routine mental health-related requests submitted by the inmates. So this is what was written up about the jail 4 years before Elliott was held there. But get this, according to Malloy, these defects that were noted in that 2007 NCCHC audit were never once addressed at the jail, and no changes were made to the medical care practices. The only response that came from this was Hosington creating some drafts of action plans. However, they were never once implemented. This sadly wasn't all. In August of 2009, an investigation into an inmate who had taken his life found that, quote, the Tulsa County Jail was not in compliance with several provisions of the Oklahoma jail standards with respect to medical and mental health care, as it was found that they failed to classify and segregate mentally ill inmates, provide timely mental health evaluation and treatment for the inmates, and failed to place the inmate in an area for more frequent observations. In 2009, an inspection by the American Correctional Association reiterated that there were several deficiencies at the jail, including in the health services area. In fact, in 2008, there were exactly 313 health-related grievances. In just 2010 alone, before June, 3 inmates had passed away at the jail. The first in March 2010, where an inmate passed away from a pulmonary embolism after complaining of chest pain for over a week, and after there was a 42-minute delay in calling emergency medical services following cardiac arrest. The next inmate had taken their own life 8 days after requesting to speak with someone in the jail, and 2 days after suicide ideation was ruled out based on a mental health exam. And in June, another inmate had passed away from cardiac arrest, which involved several standard of care issues and lack of following protocols. This was the subject of concern to many people. On October 28, 2010, the Assistant District Attorney Andrea Wyrick actually wrote an email to the risk manager of the Tulsa County Sheriff's Office with concerns over the correctional health care's compliance with its contract. She stated, quote, "This is very serious, especially in light of the 3 cases we have now. What else will be coming?" So she already clocked that this was a very concerning pattern that was shown in the jail. With this, it was no surprise the following month, in November 2010, when another audit of the jail conducted by the NCCHC showed many deficiencies in the jail's medical system. After this audit, they weren't just issued a preliminary report, because rather, the NCCHC actually placed the Tulsa County Sheriff's Office on probation because they actually met only 65% of essential standards. At the time Elliott was held in the jail's director of nursing was a registered nurse named Tammy Harrington. Prior to that, from October 2007 through August 2008, she worked in the infirmary, and from August 2008 to June 2011, she worked as a sick call nurse. And she stated that during her 3 years at the jail, she observed that the jail's medical directors, quote, repeatedly failed to provide adequate care for the inmates or supervision for the nursing staff, which created real and substantial risks to inmate health and safety, and at times resulted in catastrophic medical outcomes. During the 2010 NCCHC audit, Harrington and all other nursing staff assisted with gathering documentation about the jail's medical program. As they were doing that, the jail's health services administrator, Pam Hoisington, directed her and other nurses to find medical care records that were in compliance with NCCHC standards. However, Nurse Harrington described, quote, the records and care provided at the jail were so deficient that it would take up to 8 hours every week just to find compliant charts. Nurse Harrington also stated that she was asked to, quote, doctor medical charts by backdating undocumented information. Harrington refused to do this, and she witnessed at one point medical charts being carried out of the jail as medical records staff assisted with locating and compiling charts to be removed. Despite doing very poorly on this audit, Harrington could, quote, not recall any significant changes in medical or mental health policy or practice at the jail after the 2010 NCCHC audit results were released. Even during Elliott's trial, Sheriff Glanz and Michelle Robinette, the detention chief deputy themselves, were unable to identify specific changes made in response to the 2010 audit. The jail didn't change a thing, and they only continued to show major deficiencies in the treatment of inmates, including just the next month in December of 2010 when another inmate passed away from cardiac arrest after literally not receiving medications for a heart condition. In 2011, just a few months before Elliott passed away in the jail, an audit of the jail was conducted by the United States Immigration and Customs Enforcement, or ICE, and the Department of Homeland Security Office of Civil Rights and Civil Liberties, or CRCL. It was then on September 29, 2011, not even a whole month before Elliott was held there, when the CRCL provided the Tulsa County Sheriff's Office with a written summary of the audit findings, which included them finding that there was a, quote, a prevailing attitude among clinic staff of indifference, emphasizing doctors having to wait to see inmates due to lack of escorts, nurses were undertrained and were not documenting or evaluating patients properly. There was a lack of training and supervision shown in one case, which led to missing a diagnosis of a perforated appendix. There were 2 cases in which 2 ICE detainees had clear mental/medical problems, yet they were not seen by a doctor, and they found that the jail's medical clinic was using a homegrown system of records that fails to utilize what we have learned in the past 20 years. The CRCL medical auditor also found that a particular nurse named Sarah Jeffries had repeatedly failed to provide timely care to inmates. Now, here's where things get worse. Nurse Harrington described how she believed that Jeffries should be written up and that, quote, the dangerous conditions at the jail would never improve unless and until those providing substandard care were held accountable. So Harrington actually made a write-up of Jeffries. But get this. When the jail health services administrator at the time, Chris Rogers, was informed about this, he actually tore up Harrington's write-up and he refused to hold Jeffries accountable, which Harrington further alleged that the, quote, poor care was simply accepted by the Tulsa County Sheriff's Office and its healthcare contractor as standard. And Harrington just further asserted that what made it increasingly more difficult to get inmates the care they needed was the fact that the Tulsa County Sheriff's Office were the ones who had power over hospital referrals and Emergency Medical Services Authority, or EMSA, and the fact that the nursing staff were, quote, routinely directed by them to falsify, doctor, and backdate medical records and charts. Glanz testified that he believed the reason the CRCL even conducted the audit in 2011 was because of complaints from a Tulsa nonprofit entity named Catholic Charities. But still, no changes to improve the medical and mental health care provided to inmates at the jail came from that, with Nurse Harrington even stating that the only concern they had following that audit was, quote, maintaining the federal government's $6 million contract with the jail for the housing of ICE inmates. Despite all of the medical deficiencies shown in 2007 and 2010 by the NCCHC audit reports and in 2011 by the CRCL, Sheriff Glanz still continued to renew the contract with the jail's health services contractor, and even in 2012, 1 year after Elliott had passed away, Glanz testified that if he had to rate the performance of the medical staff on a scale of 1 to 10, with 1 being the worst and 10 being the best, he would give them a 9. With all of the evidence gathered from Elliott's case, it was on Monday, April 16, 2012, when Elliott's estate, represented by Special Administrator Robbie Emery Burke, filed a civil rights complaint against Stanley Glanz, the then sheriff of the Tulsa County Jail, the incorporations responsible for controlling operations, supervising healthcare employees, and in part developing policy for mental and medical healthcare to the jail staff, the medical team overseeing Elliott's care at the Tulsa County Jail, including registered nurse Ernie Chappell, LPN Carmen Luca, and LPN Julie Hightower, the Owasso Police Department staff who arrested and or transported Elliott to the jail instead of a mental health treatment facility, including Sergeant H.D. Pitt, Captain Tracy Townsend, Officer Jack Wells, and Officer Lem Muti. Lastly, defendants I through X, which includes staff employed by the Tulsa County Sheriff's Office, the 3 Correctional Healthcare Management Incorporation, and the Owasso Police Department / City of Owasso. The complaint described that the, quote, defendant's deliberate indifference to the excessive risks to Mr. Williams' health and safety was a direct and proximate cause of his death. Initially, a complaint was filed by Elliott's wife, Elia Laura, on November 17, 2011. However, it was in April of 2012 when Robbie Emery Burke, the administrator of Elliott's estate, replaced his wife as the plaintiff, thus filing the second amended complaint. Even before Elliott's case got to trial, the jail again was involved in another similar case in 2013, in which a woman named Gwendolyn Young passed away at the jail after staff ignored symptoms of a medical emergency. In this case, her estate won $14 million in compensatory damages and $68 million in punitive damages. However, due to attorney misconduct, they gave them the ultimatum of either doing a new trial or reducing the punitive damages to $7 million. They opted for a new trial, and it was finally on Friday, February 24th, 2023, when they won the $82 million verdict, which was a historical amount won. While there are local news articles from 2012 when the lawsuit in Elliott's case was filed, it wasn't until July of 2013 when Elliott's story truly started gaining national attention, because it was then when federal judges decided to release video of Elliott passing away at the Tulsa jail to the media. And everyone was absolutely appalled at what had happened to him. They released a 10-minute condensed video of the 51 hours he spent in that cell, showing only the times there was movement inside or outside of the cell. According to a News 9 article from July 1st, 2013, the trial for this case was supposed to be set for January of 2014. However, it wasn't until 3 years after the initial trial date and over 5 years since Elliott passed away when the case went to trial on Wednesday, February 22nd, 2017. When the case went to trial, the former medical provider of the jail, Correctional Healthcare Companies, Inc., actually settled with Elliott's estate and were no longer named a defendant. Likewise, the officers and medical staff also were no longer named as defendants. However, who did remain a defendant in the lawsuit was the former sheriff Stanley Glanz. Additionally, a new defendant that was added to the lawsuit was the then current sheriff, Vic Regalado. During pretrial litigation, Sheriff Glanz actually resigned, so his successor, Regalado, was substituted as the defendant on the official capacity claim. This essentially means the claim was against the office that employs the defendant, but not the defendant themselves. In this case, the office would be Tulsa County. As for the claim that remained against Glanz, that was filed against him in his individual capacity, meaning it was personally against him for his actions. In this lawsuit, it was alleged that Glanz and Regalado violated Elliott's 8th and 14th Amendment rights. Now, the timeline of the trial actually had some very significant moments. On day 1 of Wednesday, February 22nd, they selected a jury of 5 men and 5 women. But get this, according to the Frontier, attorneys were clashing because the defense actually tried to remove all of the 3 black jurors from the pool. Following Elliott's passing, 2 detention officers were fired. One of them, named Tammy Hanley, filed a racial discrimination lawsuit against the sheriff's office in February of 2013. She was accused of falsifying logbooks after recording that she fed Elliott at 10:50 a.m. the morning he passed, even though he was already dead by that point. But she adamantly disputed those claims, even testifying that she begged her supervisors to send Elliott to the hospital. She was not the first former black employee of the jail to bring racial discrimination lawsuits against Tulsa County. 7 cases were filed against the jail, costing Tulsa County more than $1 million to defend and settle. According to a January 2011 article by Tulsa World, quote, "The former employees alleged that they were treated differently and less favorably than white employees, were denied promotions and transfers for which they were eligible, were disciplined more harshly than white employees, and were retaliated against when they complained about unfair treatment." Specific allegations include white detention officers routinely using racially offensive language, such as the N-word, in front of black employees, and a chaplain telling racially hostile jokes in front of black employees. By that point, in January of 2011, 6 of the cases had been settled, with some of the largest settlements reaching $225,000 and $130,000. The 7th case was scheduled for trial later that year. Mind you, this was January of 2011, months before Elliott was arrested in October that year. And this appeared to be something that was going on even years prior, because in the lawsuits, they showed that in federal court documents filed in the Northern District of Oklahoma from January 2006, jail employees would actually mark an N or a W next to the names of inmates on a memo to indicate whether they were black or white, even though it wasn't necessary to do that. The second witness to testify was the inmate who worked as a trustee in the jail's medical unit at the time, named Derek Latham. He was the one to accompany Elliott while on the gurney to the medical unit. He further confirmed that Elliott was berated by staff, that the staff aggressively dumped him in the shower, and that he was left in the shower for hours. And when asked whether the treatment Elliott received by staff was consistent with how staff treated other inmates, Latham said yes. Tammy Harrington, the former nursing director, also testified that not once did the jail's medical director, Dr. Philip Washburn, go into the cell to check on Elliott. In fact, Washburn refused to do so. Billy McKelvey, a former Tulsa County Sheriff's Office captain who investigated the case, also testified that the Sheriff's Office falsified several documents involving Elliott's passing, and he testified that just overall, how Elliott was treated was a complete failure, particularly a system failure. Now, here's the thing about Sheriff Glanz that just honestly made me shake my head when I read it. For one, it took him a whole year and a half after Elliott passed away for him to finally watch the surveillance video of him in the cell. But also, Glanz was actually the longest serving sheriff in Tulsa County. He was elected in 1988. However, he actually resigned in 2015, not because of this case, but because of some illegal activities he was involved in. Glanz was actually indicted by a grand jury over a crime involving his friend. His, quote, wealthy friend named Robert Bates was involved in a fatal shooting of a man named Eric Harris in 2015. Bates was allowed to serve as a volunteer or reserve deputy. And after the shooting of Eric Harris, what Glanz did was he ordered for a 2009 report regarding Bates's lack of training to be withheld. Bates was convicted of manslaughter and sentenced to 4 years. Glanz, on the other hand, pled no contest to refusal to perform official duty after withholding the report regarding Bates's lack of training. But this wasn't all, because Glanz also pled guilty to willful violation of the law for collecting $600 of car allowance while driving a county vehicle for his own personal use. For both of these, he received 2 one-year suspended sentences, had to pay $7,500 in restitution, and he was placed on unsupervised probation for a year. During Elliott's trial, Glanz was on probation, and he further testified that the reason he pled guilty to the charge of collecting car allowance while using a county vehicle was, quote, because I couldn't afford to defend myself. These charges were the reason why Glanz retired from being sheriff, allowing Regalado to take his place as the new sheriff. Now, just to add onto the background of Glanz, on the 9th day of Elliott's trial, attorney Dan Smolin referenced a deposition that was taken just a year before the trial in 2016, where Glanz stated that he did not have an issue with the Black inmates being called negronoids or negroids. And he testified that the reason he didn't have a problem with the Black inmates being called that was because the FBI used those words to describe Black people in the 1960s and 70s. Just to continue, on day 10, the former jail medical records director, Elandia Malloy, testified that some inmates were punished by being placed naked in side watch cells, by having water poured over their food, or by having their food ground up into a loaf. And that was the day she also testified that they were asked to hide inmates' medical records during audits, as mentioned. This wasn't all. On day 13, attorneys for Elliott's estate revealed that the first 13 minutes of an interview by former officer Tammy Hanley, who was filing the racial discrimination lawsuit, was either muted or deleted by the Tulsa County Sheriff's Office. And you know what Hanley testified that she was saying during those 13 minutes? She said not only was she discussing how Elliott was treated by staff during the shower incident and other moments, but she further testified that she overheard Fike or Hinshaw say, quote, "This is a crazy N-word with the hard R," while they put Elliott in the shower. Now, I told you earlier to remember this, that in a deposition from 2013, the then Chief Deputy Michelle Robinette stated that the jail detention staff that she supervised at the Tulsa County Jail, quote, lacked human decency to take care of another human being in the way they treated Elliott Williams, and further stated that the jail staff who dealt with Elliott failed to follow training and required procedures. Remember how I mentioned that's what she initially said? Well, 4 years later, on day 15 of the trial, she testified, quote, based on the totality of the investigation, that is no longer my position. Further stating, quote, I don't believe my officers essentially did anything wrong. We did what we were required to do. What the jail officials now try to argue was that their staff did absolutely nothing wrong in this case, and that it was rather the contracted medical providers at the jail who were at fault. His brother, Kevin, stated the following.
Well, I can still see my mother's face as me and my brothers carried his casket to that grave. I can still see her face to this day. It's very devastating. I'm still emotional, as you can see. I'm still emotional about it today. Elliott will still be alive today if somebody had did something. It ain't about money. To me, it's blood money. Seriously. I just got truth. The way that they're acting today, and what I see that this defense is doing, I don't think there's no change because they can't see themselves. I don't think there's no change. There has to be, something has to be shaken up in them mentally and morally for them to change.
Also on this day, the judge, John Dowdell, actually called out the then sheriff on trial, Vic Regalado, for apparently laughing during the county commissioner, Karen Keith's testimony. Now, to talk some more about the medical staff, on day 16, it was discussed that the former medical director of the jail, named Dr. Andrew Aduse, would actually give inmates placebo injections of salt water because he thought they were faking illness. These are just a few of the very notable moments during the trial. His sister, Kimberly, stated the following.
He was the type that got up in church and offered $1,000 to any child that made all A's on their report card. So this is my brother, and this is who I miss. What's mind-boggling to me is these same people, these same nurses, the same jail staff are still working, still at Tulsa Jail, still walking around with no conscience.
Overall, the trial took a total of 17 days. After carefully reviewing the evidence and deliberating for about 10 hours over 2 days, it was finally on Monday, March 20th, 2017, when the jury found the defendants liable and Elliott's estate won their verdict against Tulsa County and the former sheriff, Stanley Glanz. Elliott's estate was awarded $10 million in compensatory damages, which was the largest civil rights death verdict in Oklahoma history at the time. They also won $250,000 in punitive damages against former Sheriff Stanley Glanz, an amount he was required to pay out of pocket. While this is where the legal battle should have ended, unfortunately, that was far from the case, because Tulsa County actually appealed to overturn the verdict, and this caused additional years of further legal battle. It was finally on Tuesday, November 12, 2019, over 2 years later, when the county agreed to pay the $10 million to Elliott's estate, and the civil rights lawsuit that was filed by Elliott's estate about 7 years prior finally came to an end. Both of Elliott's parents passed away before the trial ended. His mom actually passed away at 64 years old on July 24th, 2014, before the case went to trial, and his father passed away at 71 years old on August 31st, 2019. This was only months before the county finally signed the $10 million settlement amount. Elliott's brother Kevin described, quote, "I'm still sad the fact that my brother is not here, but I'm satisfied with their decision." Dan Smolin, an attorney for the estate of Elliott, stated, quote, "Elliott's parents have both died since the lawsuit was filed. They're not alive anymore. The administrator of the estate has spent the past 8 years dealing with these issues in hope to get some justice for Elliott Williams. There is nothing positive ever about someone who dies like this." As for the $250,000 fine to the former Sheriff Glanz, as part of the agreement, this fine was dropped. Since then, the Tulsa County Jail made changes to their healthcare providers. In 2016, Tulsa County hired turnkey clinics, now known as TK Health, to provide healthcare at the jail. But even TK Health has faced a fair share of lawsuits and criticism for their care over the years. Since 2015, up until April of 2023, they had been sued at least 160 times, and 30 of those times included inmates who have passed away. In some of these cases, TK Health has won or settled, and 2/3 of these cases were dismissed. In the cases where inmates passed away, 11 were dismissed, the company won judgments in 3, they settled in 3, and at the time, in April of 2023, 13 remained open. With a Newsweek article describing, quote, "Of the 160 overall, many were dismissed on the merits, on technicalities, or for raising frivolous arguments. But others were dismissed for reasons ranging from the inability to pay court fees to failing to meet court deadlines via mail, lacking expertise in structuring a legal argument, or abiding by court procedure." Another change they made, which was announced in a January 2017 The Frontier article, was that they were going to be adding 2 new jail pods later that year to specifically house inmates suffering from mental health issues. They were going to be adding a total of 4 new taxpayer-funded jail pods, with 2 being used for inmates with mental illness. This was going to more than double the amount of beds at the facility, which was critical because beforehand, inmates with mental health issues were just placed anywhere, whether in segregation cells, medical beds, or even general population pods. This was especially a problem for women and juvenile inmates with mental health issues. If it wasn't severe enough, they were kept in the general population area. However, for the ones who did have a severe mental illness, they were kept in the medical area of the jail, as there weren't enough inmates with mental health issues to fill out an entire wing. The problem with this was that placing them in the medical areas took away medical beds from inmates who needed medical attention. So there was a lot of moving back and forth to try placing inmates around the jail. For male inmates suffering a mental illness, those who were most at risk were placed in segregation cells. At the time in January of 2017, there were 20 males with mental illness in those segregation cells, with the rest being left in the general population as there was nowhere else to put them. There were only 4 cells for inmates who were suicidal, but with the 2 new pods, there were going to be far more space, especially to separate mentally ill inmates based on risk levels, from level 1 being the most at risk to level 4. Level 1 is the only level containing inmates who are suicidal or homicidal suicidal, and each level's housing increases in the amount of free movement allowed. The prevalence of mental illness in jails and prisons is something that is common knowledge. In 2006, the United States Bureau of Justice Statistics found that the rate of reported mental health disorders in the state prison population was 5 times greater than in the general adult population, being 56.2% to 11% respectively. These stats have remained very similar throughout the years, with about 43% and 23% of inmates in state and federal respectively having a history of mental illness in 2016. Similarly, approximately 40% of individuals who are incarcerated have at least one chronic medical condition. In general, there has been several discussions about the problem of people who are mentally ill being placed in jail instead of receiving treatment. A 2017 article from TVO mentions, quote, "While people with psychiatric conditions can commit criminal acts, as anyone can, many offenders are not responsible for their acts, so they don't belong in prison in the first place, and virtually none of the convicts, whether deserving of prison or not, are getting the treatment they need." With stats like this, it's critical that there are policies at prisons and jails that establishes the standard of care that staff, medical staff, and nurses should follow to address the mental and physical health crisis in jails and prisons. A 2025 paper by Spence et al. Titled "Neglect, Recklessness, and Deliberate Indifference in the Face of a Serious Neurosurgical Pathology: Lessons from the Tragic Fate of Prisoner Elliott Williams" discusses what can be learned from Elliott's case. Approximately 21% of inmates have reported experiencing violence while incarcerated, and this doesn't even include people who've experienced accidental injuries like the one Elliott experienced. And when there are patients who experience these serious types of neurological pathologies, if they are being neglected or if there's any indifference to their health and well-being, they are far more likely to experience severe morbidity or even lose their life. What ultimately happened to Elliott could have been prevented by so many different people at many different times. I'm talking this went through prison nurses, physicians, guards, and staff over the span of several days. Yet there was such an indifference to how he was doing that there was not even one person who put their foot down and said, "No, I'm going to get this man help. I don't care if I have to go against my colleagues' wishes. I don't care if I have to go against my bosses. I am calling emergency services because he needs to get checked out." Spence et al. Described, quote, "In this case, the multifaceted nature of such shortcomings illustrate that in the absence of multiple system safeguards, the unimaginable may occur in front of everyone's eyes, especially in areas with a long-standing culture of carelessness and disregard." The tragic fate of Mr. Williams highlights some of the systemic failures in prison healthcare, especially the insufficient response to potentially threatening conditions. Regardless of their lack of specialization, prison healthcare providers must be able to identify red flag symptoms which suggest the presence of a medical emergency. Medical professional training should also include cultural competence and sensitivity to ensure fair treatment of incarcerated individuals from diverse backgrounds, emphasizing the importance of valuing every patient equally and ensuring that complaints and symptoms are taken seriously with appropriate diagnostic tests used to rule out underlying pathologies. Now, Spence et al. Brought up something that was shown in this case regarding how healthcare providers in prisons might feel pressured from the correctional administrators, which might interfere with medical autonomy. Whether this is because the administrators want to cut costs or have intense security protocols, this constraint creates a challenging environment for healthcare providers to do their job and treat their patients. For example, Nurse Hughes asked if they could open the cell door so that Elliott could be given water, but the officers Smith and Rich said no, they can't do that because they were concerned for their safety. So what they essentially described this does is that it prioritizes financial or security concerns over appropriate medical care. Spence et al. Stated, quote, "To address this conflict, providers must receive training to safeguard their clinical independence, while administrators should be educated to respect medical autonomy." As a sort of guideline, they included sequential steps for effective incarcerated care, which entails custody, conflict resolution, medical assessment, immediate care, basic needs, collaboration and rehabilitation, and communication and reintegration. To address widespread inadequacies in prisons, they emphasize that comprehensive reform is necessary, and policy changes to try extending funding and improve care for marginalized prison populations is also very important. Likewise, it would be of benefit to have enhanced health surveillance, value-based payment models, and modernizing healthcare through simple things like using electronic medical records and allowing inmates to have access to such documents. Lastly, they mentioned that rehabilitative healthcare models for incarcerated individuals are also important in not just addressing immediate medical needs, but also long-term physical and mental needs of the inmates. Focusing on a long-term approach is really important for reintegrating inmates back into society, which ultimately would be far more beneficial to the community they return to. How Elliott was treated was just completely inhumane, and it reflects an issue faced by inmates suffering mental and physical illnesses. From the beginning, during the initial encounter with police, Elliott needed mental treatment, but was never given that. He was instead arrested. And even when he suffered a physical injury, nobody cared enough to make sure he was okay. And it's just interesting because he had no criminal history. This was the first time he was ever in a jail, and this is how they treated him. Even if he was in jail multiple times before, this was still not okay to treat him like this. But the fact of the matter is, they see that this isn't something that they could vouch, oh, it happened before, where when he was locked up, he did this before, where he faked an injury. When he was locked up this time, he faked an injury. They had no basis of this. He had never been locked up before, and they still just assumed, no, that's him. He faked it. You have to make sure you cover your bases and check to make sure that that's just not the case. This was all preventable if just one person took a step to get him the help he needed. Elliott was a brother, a son, a husband, and a friend, and he didn't deserve to pass away in such a horrific and degrading way. He should be remembered for the impact it was described he left on people's lives, and for the lessons learned from his story that will help in working towards better care for those incarcerated with mental and physical illnesses. But yes, that is it for this video. What are your thoughts on this case? Do you think there should have been more consequences for the jail and medical staff? Have you heard of any similar experiences like this? Please comment your thoughts below, and don't forget to subscribe so you don't miss any other videos on medical cases, crimes, and mysteries. Bye now.